Good morning. My name is Mr. Edward Colli, just call me E. Colli for short. I am a physician assistant student and I am going to be doing your exam. After I finish, I will report to my supervising physician and we will come up with a treatment plan for you. Do you have any questions before we get started?
Yeah. Are you just going to take my blood pressure? And what is a physician assistant?
A physician assistant is a trained and licensed medical provider who collaborates with an MD or DO, but works primarily autonomously. We are qualified to practice medicine in a variety of settings. Therefore, I will be the main provider overseeing your care and treatment today.
Oh. Okay, whatever.
Okay then. What brings you into the office today? Mr. Pedro Acnes.
Dude, just call me Pedro. Well, I'm having this issue where I have to run to the bathroom all of the time.
Tell me more about your frequent trips to the restroom. Are you having to urinate or defecate?
Defecate? Does that mean puke?
Actually, defecate means to have a bowel movement.
Oh. Yes. That. It's uncontrollable. It's explosive.
I see. About how many times a day would you say you are going?
It started yesterday and I went at least 5 to 8 times, and this morning I've already been a few times. It's almost pure liquid but the smell is rancid.
Feel free to stop the exam at any time if you need to use the facilities. It's just down the hall to the right. So I'm going to ask you a few questions about anything else that you've been experiencing. Do you ever have the urge to use the bathroom, but nothing happens? What about abdominal pain, fatigue, blood or mucus in the stool, fever, nausea or vomiting?
Yeah, my stomach is killing me. I haven't noticed any blood or mucus, like I said it's mostly just watery. I've felt tired lately, but I thought it was just because my stomach hurts so bad. I haven't checked my temperature, but now that you mention it, I feel somewhat warm. No nausea, vomiting, and every time I feel like I need to use the restroom, believe me, Doc, I do.
Okay, anything else that I didn't mention? Weight loss? Confusion? Joint pain? Rashes? Neurological problems like headache or dizziness? Have you noticed any difficulty urinating or changes in the appearance of the urine?
That's strange, Doc. Why do you need to know that? But no, none of the above.
Just a reminder, you can call me E. Colli, PA student Colli, or even Edward, but I am not a doctor. Anyways, I'm asking these questions to make sure I am not missing a serious condition or complication of your illness. Bear with me, now I'm going to ask you some other personal questions that may not seem relevant, but trust me, they are. First, is there any chance that you've been around any raw or undercooked meat lately? For example, undercooked red meat, handling chicken or poultry, eating food that has not been properly refrigerated or left out for a long period of time? Or have you changed your diet recently?
No, not that I can remember. I've just eaten my typical burger, French fries, and whatever my mom makes for dinner.
Okay, have you been camping, traveling, or have you been in the woods lately? The reason I ask is that there are certain organisms that thrive in fresh water and other natural sources that could cause you to have these symptoms if ingested.
No, I went paintballing with my friends the other day, but dude, we live in the city. I don't know where you hang out, but I don't become one with nature during my free time.
Haha. I get why this might seem odd to you, but we are almost finished with the interrogation, I promise. Last, I just need to ask about your personal history as well as your family history.
Like where I was born and where I came from. Like my ancestry and lineage?
Not exactly. I was wondering more about your personal and your family's medical history. Have you had any problems like this in the past? What about surgeries or procedures you've had? Do you know of any conditions such as this that other members of your family have encountered?
Well, I've had some diarrhea in the past, but never has it been this violent. It's just so nasty. Other than the occasional cold, I'm pretty healthy. I think my family is pretty healthy, but I don't really know. My dad is kind of fat and my sister seems to be always crying and moody, but I think everyone is okay.
Great. Before I forget, I would like to ask you about any medications that you are taking, including prescriptions, over-the-counter medications, supplements, daily vitamins, or anything similar.
Well, as you can see, I work out a lot, so I always take my protein powder before I go on runs. And especially when I hit the weight room. Other than that, I just started taking this pill because I break out a lot.
Do you remember the name of the medication that you were prescribed?
Well, I tried this one kind, but I don't know the name. They told me not to go out in the sun very much and to let them know if I noticed my teeth darkening, but it wasn't really helping anyway, so they switched me to a different one. I remember them telling me that with this new medication, I need to be watchful for difficult, or something like that. Something. Not really sure what that means, but I can't see how that is related.
Are you taking a medication called clindamycin, perhaps? Does that ring a bell?
Actually, that does sound familiar. How did you know?
Well, C. diff, or Clostridium difficile, is a common side effect of clindamycin and is known to cause watery, foul-smelling diarrhea due to its interference with the normal bowel flora in your intestine. Is that the diff that you were thinking about?
Yeah, but I don't get it. Flora? Does that mean I have flowers in my guts?
Haha. Not exactly. Intestinal flora is the good bacteria that is found in the gut. The bacteria have several beneficial functions that help to regulate the digestive tract. One of the most important functions is preventing the bad bacteria from invading and taking over. This concept is known as simple crowding. Another role that the good bacteria fill is the creation of important vitamins such as vitamin K, folic acid, and vitamin B12. Finally, intestinal flora ferments the undigestible fiber, which is an important function of the digestive system. If this flora is disrupted, problems can arise. In your case, the clindamycin killed the good bacteria. Since the good bacteria are not there to metabolize carbohydrates, the result is osmotic, or watery, diarrhea.
Oh. Okay, so does that mean that I'm going to have this diarrhea problem for the rest of my life? Because if so, that's really going to mess up my chances with the ladies.
I think that's the least of your worries. But no, this is a very temporary condition that will most likely go away after we adjust your acne medication regimen. First, I'm going to prescribe a topical agent called tretinoin that you are going to apply to your face once daily before you go to bed. Also, to replace the clindamycin, I'm going to switch you to an erythromycin base, which you will take twice a day. This is your new regimen to help heal your acne. In addition to this, I'm also going to prescribe metronidazole for 2 weeks, which will help stop the diarrhea. Do you have any questions?
No, that was a very thorough exam. I am very impressed with your so-called PAs. And I think I might start seeing a PA exclusively from now on.
Great. I'm glad you had a good experience and I hope that this regimen works for you. If your diarrhea does not improve, or even worsens within the next few days, call the office or go to the emergency room. If the diarrhea does not go away within this time frame, there might be other causes for it and we will have to do more extensive testing. For now, I am very confident that you will experience relief with this regimen. Wait here and I will consult with my supervising physician.
Dude, you are good. I trust that you know what you're doing. Just give me my prescriptions. And hurry. I can hear nature calling, if you know what I mean.
I will be quick. Go ahead and check out, and I will fax your prescriptions to the pharmacy, so you have no delay. Take care and call the office if you need anything.
Okay, bye.